This adjustment is a supine bimanual grasp, proximal tibia with knee extension for a long axis restriction of the tibiofemoral joint. In this adjustment, our patient is supine here. Docs, you're going to grab a contact on that distal tib fib, kind of close to the ankle, making sure you're not crunching down on the ankle with your leg contact here. I like to give the knee a little bit of flexion to start, palpating around the joint between that tibia and femur here, that tibiofemoral joint. And then, docs, you'll palpate through here, you'll load, and then it's just a quick thrust with your knees, gapping at the knee. Now, it's not unusual for patients to say, hey doc, I felt that in my hip as well. Sometimes if we are a little bit slower on our impulse, we can definitely cause this adjustment or this force to be translated through the hip. So there is a quick modification that I'd like to show you guys in this video. If you remember back to the palpation, I had us grab that distal femur and push inferior to superior on that distal femur while we pulled superior to inferior on the tibia itself. And so what we'll do is we'll actually replicate that with the adjustment, but now we're just going to add a little bit of an impulse to it. So what that looks like is this. Now again, my first contact I was here, which is on the proximal tibia, but here I'm going to move up and I'm going to establish a contact on the distal femur. And so what you'll see is, if you watch my patient, you'll see them kind of move up the table as I provide that I to S force on that distal femur. So here, and then I'm going to load through the tibia and pull. And my goal here is to influence the hip less. So again, this is if I have somebody that has some sort of a pre-existing condition in the hip itself, maybe they can't have this type of force put through that hip joint, and this is a good alternative to that. So this was a supine bimanual grasp, proximal tibia with knee extension for a long axis restriction of the tibiofemoral joint.